Hey, this is Brian and welcome to Davis Foot Orthotic Solutions web series, Insight from the Speaker. Today we are going to speak with Dr. Joanne Cicero. She's a licensed physical therapist, a certified yoga instructor, and a certified lymphedema therapist. She is also a clinical assistant professor at SUNY Stony Brook in the Department of Physical Therapy in the School of Health Technology and Management. Dr. Cicero will be presenting a course for Davis Foot Orthotics on February 11th, 2015, so coming up soon, entitled Therapeutic Yoga, a Tool for Creating Wellness. Welcome, Joanne.
Thank you, Brian.
Okay. So why don't we start with telling me what got you interested in yoga?
I guess I've always been very active. I danced as a child and as a young adult, and I also was an Arthur Murray dance instructor for a few years. But it was probably in my mid-20s, one of my coworkers invited me to a yoga class, and I decided I would try it, and that was it. I was in love after that. I loved the quietness of the practice and the introspectiveness, and I also really embraced the philosophy. So I've been practicing ever since.
So how long have you been practicing yoga?
Well, it's probably about 30 years that I've been a practitioner and about 20 years that I've been actually an instructor. It's been quite a long journey for me in the yoga field, but I would say it really took a big turn for me in 1995 when I traveled to India for 1 month to study with Mr. Iyengar, my teacher, and his family in Pune. And there I was able to observe the medical classes, and it was just fascinating to watch the way that yoga was used therapeutically. After that, I came home and decided that I wanted to understand the science behind the yoga effectiveness, and so I first got my certification, and then I went to school for physical therapy.
So you've been a yoga instructor much longer than a physical therapist.
Yes, yoga is actually what brought me to physical therapy, yes.
Very interesting. So now, how have you been able to integrate the yoga into your therapy practice, or have you been able to?
I actually have been able to. I was very fortunate. After I graduated from Stony Brook's PT program, was in the first DPT class actually, I went to work at St. Charles for a couple of years, and then I went over to Stony Brook's outpatient clinic, and the director there was very interested in yoga and allowed me to teach therapeutic classes. I taught once a week for the patients who were just finishing up in physical therapy, so they were kind of in between their rehab and a community class. And knowing their diagnoses, I was able to work with them and modify the poses. But within the clinical setting, I also did work a lot with patients, really more about the mind-body connection. I trained or taught them how to be attentive to their bodies and the way their body responded to the different exercises. Mm-hmm. And some people requested yoga, so I was able to work with them particularly and show them poses and how to modify for their diagnosis. So
you do this in a group scenario. Can you do it in an individual scenario as well?
Yeah, I in the group setting, that was a class that met once a week, but with my individual patients, some of them would come in and say, I want to return to yoga, but I have this rotator cuff injury. How can I do that? Oh. And so I would help them to modify the poses. I showed them how to work safely. Some wanted to incorporate yoga poses into their rehab, so I was able to do that. And others, it was really a matter of just teaching them breath awareness and connecting to their body.
Okay. What types of patients have you done therapeutic yoga with?
Oh my goodness, all types of patients. Low back pain, neck pain, knee replacements, ACL repairs, Parkinson's disease, multiple sclerosis, pregnancy. Oh my goodness, pretty much the full gamut. Spinal cord injury, really a wide range.
Okay, so tell us about this upcoming course.
Yeah, I'm really excited about it. I think that what I would like as far as objectives, I would like the participants to come away with a really good understanding of yoga and the philosophy, because I don't feel that you can disconnect the philosophy from the actual physical practice. I also will be focusing on specific poses for certain diagnoses, and will show the participants how to modify the poses to make the practice or that particular pose safe for their patients. Really pretty much throughout the continuum of care. So I'm really looking forward to it.
Now, what type of therapist should go? Is it therapists that work only with adults, work with kids, work with particular diagnoses, or do you think it's a course that anybody could go to? That
I absolutely feel that it can really range from all the way across the board, from pediatric to geriatric. There are very specific courses for pediatric yoga, but this will at least introduce a pediatric therapist to the ways in which we can modify the poses for the children in their population. So I would say it's really for whoever, in whatever areas.
okay. Well, I thank you for taking time out to speak with us today,
It was my pleasure.
and I'm looking forward to this course very much.
Me too, Brian. Thank you.
So, once again, Dr. Cicero will be presenting a course for Davis Foot Orthotic Solutions on therapeutic yoga, a tool for creating wellness. It should be a good one. It's going to be part lecture, part demonstration, and part lab participation. So stay tuned. Hopefully we'll see you there, and we'll see you at the next Insight from the Speaker series coming to you soon. Thank you very much.